Welcome to the Cultural Diversity in Healthcare Training by Comfort Home Health Agency. In today's video, we'll explore the importance of recognizing and respecting diverse cultural backgrounds in healthcare. We'll discuss real life scenarios and practical strategies to navigate language barriers, religious beliefs, traditional medicine, and cultural norms, ensuring that every patient receives the care they deserve. So let's dive in and enhance your skills in delivering culturally competent care. Cultural diversity in healthcare refers to the presence of various cultural, ethnic, religious, and linguistic backgrounds among both patients and healthcare providers. It acknowledges that people from different cultures may have unique beliefs, values, and practices related to health and healthcare. In this section, we'll discuss the importance of cultural diversity in healthcare. Recognizing and respecting cultural diversity improves patient care, satisfaction, and overall health outcomes. Understanding diverse cultural perspectives help in effective communication, which is crucial for diagnosis and treatment. Healthcare providers who are culturally competent can provide better care, leading to trust and better health compliance. Many countries have laws and regulations that mandate culturally sensitive healthcare practices. Now that we know its importance, let's look into the risk of ignoring cultural diversity in healthcare. Misunderstanding cultural beliefs and practices may lead to incorrect diagnosis or treatment plans. Patients may become disengaged or non-compliant if they feel their cultural needs are not being respected. Ignoring cultural diversity can result in ethical issues such as informed consent or end of life decisions. Discrimination or neglect can lead to legal issues for healthcare institutions. Now that we know the risk, let's now delve into the examples of cultural diversity in healthcare. Patients who speak different languages may struggle to communicate their symptoms and understand medical instructions. Let's take a look at this example situation. Sarah, a healthcare provider, is attending to Mr. Gomez, a middle aged patient who speaks limited English. He's experiencing severe abdominal pain and is visibly distressed. Sarah's primary language is English, and she doesn't speak Spanish, which is Mr. Gomez's native language. Recognizing the language barrier, Sarah immediately contacts her coworker Grace, who is fluent in both English and Spanish. This ensures the accurate communication. While waiting for Grace, Sarah uses nonverbal communication to convey empathy and reassurance. She maintains eye contact, offers a comforting touch on the shoulder, and smiles to show support. In the meantime, Sarah uses simple, clear, and non technical language. She points to her own abdomen to inquire about the location of Mr. Gomez's pain. She also uses gestures and miming to ask yes or no questions. If Grace is not immediately available, Sarah may inquire if Mr. Gomez is a family member or a friend who can interpret for him. While not ideal, it can be a temporary solution to ensure essential information is conveyed. In critical situations, Sarah may use written materials such as medical charts, diagrams, or translation apps to help bridge communication gap. She can point to words and phrases to convey important information. If a procedure or treatment is required, Sarah ensures that Mr. Gomez provides informed consent. She ensures that he understands the risk, benefits, and alternatives before proceeding. It's crucial to document the use of language services and steps taken to address the language barrier in the patient's medical records. This is essential for legal and quality of care purposes. After the interpreter arrives and the communication barrier is resolved, Sarah checks in with Mr. Gomez to ensure he fully comprehends his diagnosis, treatment plan, and any medications prescribed. Throughout the interaction, Sarah remains culturally sensitive, respecting Mr. Gomez's individual needs and beliefs. She acknowledges the challenge the language barrier presents and expresses her commitment to provide the best care. By following these steps, healthcare providers can address language barriers effectively and ensure that patients like Mr. Gomez receive the care and information they need, regardless of their language proficiency. This approach promotes patient safety, informed decision making, and a positive healthcare experience. For religious beliefs, some patients may have religious dietary restriction, fasting practices, or specific burial requests that needs to be respected. Let's look at this example situation. Nurse Maria is caring for Mrs. Patel, a devout Hindu patient who is hospitalized due to a serious illness. Mrs. Patel observes various religious practices, including dietary restrictions, prayer times, and the use of specific items for worship. She's distressed about how her illness may affect her religious observance. Nurse Maria starts by asking Mrs. Patel about her religious beliefs and practices, including dietary restrictions, prayer routines, and any other customs that are important to her. If Mrs. Patel has specific dietary restriction due to her religion, Nurse Maria consults the hospital dietary services to ensure that her meals comply with her religious requirements. Nurse Maria makes arrangement for Mrs. Patel to have a quiet private space for her daily prayers and provides a list of local religious leaders or volunteers who can visit her for spiritual support. If Mrs. Patel requires specific religious items for her worship, Nurse Maria ensures that these items are readily available to her in her room. Nurse Maria discusses the timing of medication administration and medical procedures with Mrs. Patel, taking into account her prayer times and any religious events she wishes to participate in. Mrs. Patel's religious belief may also include modesty and privacy requirements. Nurse Maria ensures that her modesty is respected during examination or procedures and take measures to maintain her dignity. Nurse Maria offers to involve a chaplain or a religious leader who can provide spiritual guidance and support in line with Mrs. Patel's beliefs. Nurse Maria communicates with the healthcare team, including the attending physician, about Mrs. Patel's religious needs to ensure that all members of the team are aware and can provide appropriate care. Nurse Maria makes detailed notes in Mrs. Patel's medical records about the religious accommodations provided and any discussions held with the patient regarding her religious needs. Throughout the care process, Nurse Maria demonstrates empathy and reassures Mrs. Patel that her religious beliefs and practices are respected, and every effort is being made to accommodate them. By addressing Mrs. Patel's religious beliefs and respecting her customs, Nurse Maria ensures that the patient feels supported and understood during her experience with us. This approach not only promotes the patient's well being, but also enhances trust and cooperation between the patient and healthcare provider. Patients from certain cultures may use traditional or alternative medicines alongside Western treatments, which can affect medical interactions. Let's take a look at this example to make us understand better. Dr. Lee is a physician in a primary care clinic, and he's seeing a new patient, Mr. Nguyen, who is originally from Vietnam. Mr. Nguyen has been diagnosed with a chronic medical condition and has been using traditional Vietnamese herbal remedies alongside his medication. He is concerned about the potential interaction between his traditional remedies and the prescribed medications. Dr. Lee starts the conversation by welcoming Mr. Nguyen and expressing interest in his use of traditional medicine. He ensures that patient feels comfortable sharing this information. Dr. Lee asked Mr. Nguyen to describe the traditional remedies he's using, including the names, ingredients, and any known effects or benefits. Dr. Lee listens to Mr. Nguyen's concerns and any potential side effects or interaction he is worried about. Dr. Lee provides information about the patient's diagnosed medical condition and the prescribed Western medications. He explains the potential interaction or contradiction with the traditional remedies. Dr. Lee engages in shared decision making with Mr. Nguyen. They discuss the risks and benefits of continuing with the traditional remedies alongside Western medicine. Dr. Lee respects the patient's autonomy and decision in this regard. If Dr. Lee is not knowledgeable about the specific traditional remedies used, he may consult with a colleague who has expertise in traditional medicine or seek advice from a cultural consultant. Dr. Lee emphasizes the importance of regular follow up appointments to monitor the patient's condition, assess any changes, and ensure the combined treatment plan is effective and safe. Dr. Lee documents the patient's use of traditional remedies and the agreed upon treatment plan in the patient's medical record. This ensures that the other healthcare providers are aware of the situation. Throughout the conversation, Dr. Lee maintains cultural sensitivity, showing respect for Mr. Nguyen's beliefs and practices, and avoid any judgment or criticism. Dr. Lee encourages open communication and invites Mr. Nguyen to reach out if he has any concerns, experiences side effects, or wishes to make changes to his treatment plan. By addressing the use of traditional medicine in a respectful and informed manner, Dr. Lee ensures that the patient's healthcare needs are met while taking into account his cultural practices. This approach promotes patients' engagement and collaboration in their healthcare decisions, while minimizing potential risk associated with combining traditional and Western treatments. Let's now move on to the section on cultural norms. The perception of pain, modesty, and decision making can vary significantly among cultures. Let's check out this scenario involving cultural norms to better understand what I mean. Nurse Rodriguez is taking care of a patient, Mrs. Ahmed, who is a devout Muslim. Mrs. Ahmed is hospitalized for a surgical procedure, and she follows strict Islamic cultural norms regarding modesty, gender interaction, and prayer times. She is concerned about how these norms will be respected during her admission. Nurse Rodriguez begins by having a conversation with Mrs. Ahmed to understand her cultural norms and religious beliefs. She asks about specific practices related to modesty, gender interaction, and prayer times. Nurse Rodriguez ensures that Mrs. Ahmed's privacy and modesty are respected during all medical procedures, examinations, and while dressing and undressing. She explains that same gender healthcare providers will be assigned whenever possible. Nurse Rodriguez inquires about Mrs. Ahmed's prayer schedule and ensures that she has access to a private and clean space for her daily prayers. She communicates with the hospital chaplain or religious service to arrange for a prayer material or a prayer rug. Nurse Rodriguez explains all procedures and treatments to Mrs. Ahmed in detail, making sure she understands and consents to each one. This is essential to align with Islamic principles. Nurse Rodriguez coordinates with the dietary department to provide meals that adhere to Mrs. Ahmed's dietary restriction, which may be due to her cultural and religious norms. If language is a barrier, Nurse Rodriguez ensures that an interpreter is available to facilitate clear communication. This ensures that Mrs. Ahmed is well informed about her care. Nurse Rodriguez discusses the gown and dress code in the hospital, making sure Mrs. Ahmed is comfortable with it. If necessary, she allows for modifications that respect the patient's cultural norms. Nurse Rodriguez maintains detailed notes in Mrs. Ahmed's medical record regarding her cultural norms, the accommodations made, and any discussions held to ensure consistency in her care. Throughout the care process, Nurse Rodriguez demonstrates cultural sensitivity by respecting and acknowledging Mrs. Ahmed's beliefs and practices. She expresses a commitment to providing care that aligns with these cultural norms. By addressing Mrs. Ahmed's cultural norms and showing respect for her beliefs and practices, Nurse Rodriguez ensures that the patient feels valued, supported, and understood during her hospital stay. This approach not only enhances the quality of care, but also promotes trust and a positive healthcare experience. In healthcare, understanding and respecting cultural diversity is essential for providing effective, compassionate, and safe care. We've discussed scenarios involving language barriers, religious beliefs, traditional medicine, and cultural norms, alongside with strategies to address them. Now, it's time to reinforce your understanding. Proceed to the quiz to test your knowledge and ensure you can apply these principles in your healthcare practice. Thank you for your commitment to providing culturally competent care.